Welcome to the Deep Dive, where we take a stack of information, articles, and research and transform it into clear, actionable insights for you. Today, we're tackling something many of us engage with regularly but might only scratch the surface of: managing high blood pressure. You might diligently monitor your blood pressure at home with a cuff, thinking, you've got it covered. But what if everything you thought you knew about managing hypertension was just the tip of the iceberg? Today, we're diving deep into some surprising revelations from our sources about vital tests you might not even realize you need, tests that hold crucial clues to your broader health story.
Indeed. And our sources, including some really important insights from Dr. Mohammed Yusuf Khora, they truly underscore that these routine lab tests are far from an optional extra. They are absolutely fundamental. They help doctors monitor how effectively your medications are working, understand the subtle progression of the condition, and, critically, identify underlying risks that could be, well, quite serious. It's about getting a truly comprehensive picture of your health, not just relying on a single number from the cuff.
Okay, let's unpack this then. Let's dive into what your doctor might actually be looking for and why these deeper insights are so important for you. When you mention these routine tests, I imagine many listeners, like many patients, might initially react with a bit of surprise. They'd probably think, blood pressure, don't I just measure it with my home monitor? What else could there possibly be to test? It's such a common starting point, isn't it?
Oh, it's an incredibly common and understandable misconception. Absolutely. Yet what our deep dive into the research makes crystal clear is that those tests go far beyond just confirming hypertension. They are essential for understanding the type of medication that's best suited for you, refining the correct dosage, and tracking the disease's progression over time. They provide a vital layer of information that a simple blood pressure reading alone simply cannot capture, revealing potential complications or underlying issues before they become major problems.
That makes perfect sense. So we're essentially looking for the hidden stories your body is telling, beyond just that pressure reading. Let's start by uncovering something fascinating that often gets overlooked in a standard checkup: the complete blood count, or CBC. You might think, for instance, that high hemoglobin, that protein in red blood cells carrying oxygen, is always a good thing, like a sign of robust health, right?
Yeah.
The opposite of anemia, so surely more oxygen carrying capacity is beneficial.
That's a very common and honestly logical assumption. But the reality about very high hemoglobin levels, especially for someone with hypertension, can be quite different and critically important. See, for men, the normal hemoglobin range typically sits between, say, 14 to 16 grams per deciliter, and for women, it's usually 12 to 15. However, when we see levels climb significantly, perhaps to 19, 20, or even higher, particularly in men, well, that's not a sign of super health. Instead, it indicates a serious condition we call polycythemia.
Polycythemia. Okay, what exactly is happening in the body when someone has that condition?
Well, in polycythemia, the bone marrow, which is essentially the body's blood factory, starts producing too many red blood cells. And this isn't beneficial. It actually points to one of two critical underlying issues. Either the body is chronically lacking oxygen, causing it to kind of overcompensate by pumping out extra red blood cells, or there's a primary problem within the bone marrow itself causing this overproduction.
Right. So how do doctors distinguish between those two scenarios, an oxygen deficiency versus a bone marrow problem? Is there a specific tell in the blood work?
Yeah, doctors have clever ways to pinpoint the cause. If several components of the CBC, not just hemoglobin, but also platelets and white blood cells, are all unusually elevated, that often makes us more suspicious that the problem originates in the bone marrow. In those cases, a patient would typically be referred to a hematology consultant for further investigation, sometimes requiring more specialized tests, maybe even a bone marrow sample. However, if it's primarily just the hemoglobin that's elevated, with platelets and white blood cells remaining relatively normal, or maybe platelets just slightly up, then we're more likely looking at an issue of oxygen deficiency, perhaps due to lung problems or sleep apnea, something like that.
That's a crucial distinction. But zoom out a bit for us. For a patient managing high blood pressure, why is high hemoglobin, this polycythemia, such a significant problem? What are the practical implications?
Oh, it's a very big problem indeed. Think of it this way. High hemoglobin means a much higher concentration of red blood cells. This makes your blood thicker, more viscous, almost like syrup instead of water.
Wow.
And this thicker blood dramatically increases the risk for dangerous blood clots. Now, for someone already dealing with hypertension where arteries might already be narrowed or stiff, this risk becomes critically perilous. I mean, a blood clot could lead to a stroke, a heart attack, or blockages in other vital organs. Catching and managing this early can literally be life-saving.
Wow, that paints a really vivid picture of the danger there. And platelets, they also play a role in clotting, right? When do they become a danger, especially for hypertension patients?
Absolutely. Platelets are essential for blood clotting, but yeah, too much of a good thing can be very bad. Their normal range typically falls between, let's say, 150,000 to 450,000 per microliter, though labs can vary slightly on that. While some fluctuations are normal, when platelet levels climb significantly higher, maybe up past 800,000, into the very high hundreds of thousands or even millions, that's when it signals a disease state. These drastically elevated levels massively increase the risk for clots, which, as we just discussed, is profoundly dangerous for individuals with hypertension.
So finding the cause is key.
Exactly. Finding and treating the underlying cause is paramount to mitigate this really serious threat. And just a quick note, while white blood cells are important for fighting infection, their levels don't typically play a big direct role in hypertension itself, unlike hemoglobin and platelets.
Got it. Okay, so we've looked at the blood itself, but what about the organs that are constantly filtering it? Our kidneys. As we've explored in past deep dives, they're in a constant vital dialogue with your blood pressure, aren't they?
That's a powerful reminder of just how central kidney health is, not just for kidney function itself, but absolutely for managing blood pressure. Our sources strongly reiterate that any impaired kidney function or underlying kidney problems can directly contribute to raising blood pressure. The kidneys are crucial for regulating fluid balance and certain hormones, so if they're not functioning optimally, it has a direct and often immediate impact on blood pressure levels. This makes consistent monitoring absolutely crucial.
Given that critical link, what are the key kidney function tests doctors typically look at to assess their health? What should people know about?
Well, there are three main tests we rely on. First, there's creatinine, which most people are probably quite familiar with. It's a common waste product, and its level gives us a good indicator of how well the kidneys are filtering. Pretty standard test. Second, we look for protein in the urine, specifically a protein called albumin, through a test often called urinalbumin or microalbumin. Now, while high blood pressure doesn't usually cause protein in the urine directly, its unexpected appearance during a routine check is a significant red flag. It suggests a potential kidney problem that warrants immediate and closer monitoring. Definitely something to watch.
Okay, that makes sense.
And third, the glomerular filtration rate, or EGFR. Think of it as your kidney's personal efficiency report. It tells us exactly how well these vital filters are clearing waste from your blood. This test is indispensable for identifying any existing problems with kidney function and tracking their progression over time.
These tests really show the kidneys are much more than just filters. They're active participants in maintaining blood pressure. It's fascinating. This raises another important question, one that might surprise many listeners. What about tests like hemoglobin A1C? That's typically associated with diabetes, right? What on earth does that have to do with managing blood pressure?
You've hit on a crucial point that ties so many seemingly separate health indicators together. It's really interesting. What's truly fascinating here, and often an aha moment for patients, is understanding that diabetes, high cholesterol, high triglycerides, and elevated uric acid, they're often all symptoms of a larger interconnected condition we call insulin resistance syndrome. It's essential to monitor all of them because they don't operate in isolation. They are pieces of the same puzzle, really.
So if someone has high blood pressure, their doctor might be looking at their A1C not just for diabetes, but as a sign of this broader metabolic issue. Can you elaborate a bit on why each of these markers?
Well-established, very strong link between diabetes and hypertension. Diabetes significantly increases the risk and severity of high blood pressure. They often go hand in hand. Then we have cholesterol and triglycerides. High levels of these fats are profoundly important for people with high blood pressure because they accelerate atherosclerosis. That's the hardening and narrowing of the arteries.
Right, the plaque buildup.
Precisely. And this arterial stiffness, in turn, makes the heart work harder and directly contributes to elevated blood pressure. So managing those facts is key. Finally, uric acid levels. They're monitored not just for gout, although that's important too, but because they are another indicator of insulin resistance. They reflect the body's overall metabolic state and its potential impact on blood pressure regulation. So these aren't just separate risks, they're all contributing factors in a complex interplay.
It really sounds like a truly complex web, with all these systems influencing each other. What about other important organs, like the liver or thyroid? Are they active players in this whole picture, too, when we're thinking about hypertension management?
Absolutely, they are. The liver and thyroid aren't just bystanders, they're active players, and monitoring them provides another layer of critical information. Liver function tests, for example, are often performed to check for conditions like fatty liver, which again is another common component of that insulin resistance syndrome we talked about.
Ah, okay.
These tests are also vital because if a patient has high blood fats and is taking cholesterol-lowering medications like statins, well, these drugs can sometimes affect liver enzymes. So close monitoring is necessary to ensure the medications are safe and effective and not causing any liver issues.
Makes sense.
And then there are thyroid tests. An overactive thyroid gland, a condition known as hyperthyroidism, is known to directly raise blood pressure. It does this by increasing heart rate and overall metabolic activity. So regular monitoring of thyroid function is very important to rule out or manage this often overlooked cause of hypertension.
Wow, that's an incredibly comprehensive list. Just to recap for our listeners, we've talked about the complete blood count, looking at hemoglobin and platelets, then urine albumin for protein, kidney function tests like creatinine and eGFR, liver function tests, thyroid function tests, plus HbA1c, cholesterol, triglycerides, and uric acid. I mean, it's a lot to process. So, given the depth of these insights, should we be doing all these tests every 3 months, just like with some diabetes protocols, or is the frequency different for hypertension?
That's a great and very practical question for patients. For hypertension, it's not necessarily every 3 months across the board, no. The typical frequency is often more like every 6 months, but this schedule is highly individualized. It really depends. It depends greatly on your specific health status, the severity of your hypertension, the medications you're taking, and critically, your treating physician's assessment. There's no one-size-fits-all schedule here. It's a dynamic process tailored to your needs.
Right. So flexibility based on the individual. What's the single most important takeaway you want our listeners to walk away with today? Beyond all these specific tests, what's the anchor point?
The most important thing, I think, above all else, is that as a hypertension patient, you must maintain regular, consistent follow-up with your doctor. That relationship is key. It is your doctor who, based on their expertise and understanding of your unique health profile, will tell you which regular tests you need. They're the ones reviewing those results, assessing how your medications are impacting your body, and evaluating the overall progression of your condition. They use these insights to fine-tune your treatment plan, catch potential problems early, and guide your journey. Self-monitoring at home with your blood pressure cuff is excellent and highly recommended, don't get me wrong. But it doesn't, and it cannot, replace that expert medical oversight and the deep understanding these lab tests provide. It's really about empowering your doctor to provide the best, most informed care possible for you.
It's so clear that managing a high blood pressure is far more nuanced and proactive than just looking at a number on a monitor. It really is about understanding a whole symphony of health indicators and having an expert guide you through it. Our deep dive today has truly shown the hidden complexity behind something we often take for granted, transforming it into vital knowledge.
Yeah, and what's truly fascinating here is how these seemingly disparate tests paint this comprehensive, interconnected picture of your body systems. They don't just confirm a diagnosis, they reveal potential issues before they escalate, highlighting the incredible value of regular medical follow-up and, frankly, the proactive power of knowledge. Knowing why these tests are done empowers you to be an informed, active participant in your own health journey, working alongside your doctor.
So the next time you think about your blood pressure, consider not just the reading on the cuff, but the silent, vital stories these routine tests could be telling you about your overall health. What unexpected connections might your body be revealing through these crucial indicators, and how might understanding them empower you to take even better, more proactive care of yourself? Thank you for joining us on the Deep Dive. We hope this exploration has given you a fresh perspective and